So frostbite is when the tissues actually start to freeze, and you get freezing all the way down to the level of the cells. When this starts to happen, you get blood supply that's compromised getting to the tissues, particularly when we think about fingers and toes, your ears, your nose, those kind of places. Once that blood supply is compromised, those tissues can actually start to die. And so really you're at risk for frostbite anytime you've got inappropriate clothing or no clothing exposed in a very cold environment. Early on, you get what we call non-freezing cold injury, and that's that feeling you get when you start to get the tingling in your fingers or your nose, sometimes your toes. From there, it can progress on to actually having pain in those digits. Once people start to experience that pain, it's time to get out of the cold. It's time to start getting warmed up before that can progress on to frostbite. The colder it is, the higher the risk of frostbite. Also, the more moisture that's in the air, the higher the risk of frostbite, because when things are damp and they're cold, the risk of frostbite is increased. And then if that wind chill is really, really high, the worse the wind chill, the worse our risk of frostbite. Make sure that you've got good warm coverage on your head. You lose a lot of heat through your head. Warm coverage on your head, warm coverage on your core using multiple layers. Multiple layers are going to be better than one layer. When it comes to things like your hands and feet, you don't want anything that's going to constrict the blood flow. You want to keep plenty of blood flow there. And again, you want to use layers whenever possible. If it's really cold, mittens are going to be better than gloves, because the mittens keep your fingers together so that they can transmit the heat better. With your feet, you want to make sure that you've got multiple layers of socks on, warmers in your feet, in your shoes if possible, on your socks, not directly on your skin, but on your socks. And the same thing applies to the feet. We don't want footwear that's too tight to where it's going to actually constrict blood flow. The sooner you get treatment from frostbite, the better. So as soon as we recognize frostbite, the better. We're definitely going to have the best success within the first 24 hours, but ideally we want it to be as short as possible. Really kind of time is tissue in this case, and so the sooner folks can get in and get treated, the better chance of them having a good outcome.